and welcome everyone. Welcome to the webinar. This is Meeting the Lyme Challenge with Masterful Choices. We have Dr. Gurgler here. We also have Lori Tran, and I'm Nicole White. We are going to discuss and talk about all of the different things around Lyme disease today. And let's start off with Dr. Gurgler. I'm going to read off a little bit of his biography. Dr. Gurgler is board certified in gastroenterology and internal medicine with 30 years clinical experience, residency, internship, and fellowship in gastroenterology, and then obtained in Boston Institutes at St. Elizabeth Hospital, Leahy Clinic, and Boston Veterans Administration Hospital. Additional holistic courses and workshops were part of his training, including SCENAR for pain disorders, quantum touch hands-on healing, herbal medicine, nutrition, Lyme disease, and hypnosis. Dr. Gurgler is a Lyme literate physician utilizing a wide array of unique protocols, which gives special focus to treating this condition. He studied with a Native American healer for 4 years, training in chelation therapy and intravenous therapies, which obtained in conjunction with the American College of the Advancement of Medicine. Dr. Gurgler has experience in the natural treatment for many of the chronic disorders, including candida, chronic fatigue, fibromyalgia, chronic hepatitis, gastrointestinal disorders, cardiac disease, chronic dermatitis, allergic conditions, dementia, chronic neurologic disorders, and autoimmune conditions. Special attention is given to treating gastrointestinal issues as they relate to chronic disease. Lori Tran is an author, speaker, and advocate for self-empowerment. Her first book in a series of 3, A Victim No More, How to Stop Being Taken Advantage of, proved to offer a skill set that has freed thousands of her readers to turn their lives around, even after suffering multiple traumas and illnesses that dropped them to their knees. She takes great pride in celebrating her healing process with others, a process that she teaches with powerful insights and effective tools and insights that helped her climb out of the destructive cycle of feeling victimized herself. She is passionate about teaching the process with a goal to empower others to join her in creating a life worth living. In fact, she considers it her life purpose and passion. She has integrated her body, mind, spirit work as she stepped into becoming Chief Operating Manager of ORB Services, LLC. The company was formed to bring out an all-natural breakthrough treatment for Lyme disease and autoimmune disorders with the same collaborative approach that she uses in her work with A Victim No More series of books, courses, and upcoming conferences. Dr. Gurgler, welcome, welcome. I'd love for you to start us off and tell us, for maybe people who have Lyme or have family members who have Lyme, tell us about this challenge with Lyme disease.
Well, as people might know, the Lyme disease is a special disease unto itself. It's much more widespread, involves most of the organs and systems of the body, unlike most other diseases, and requires special expertise both in Western medicine and holistic medicine to take care of it. It's not a simple disease. There are a lot of aspects to it, and treatment is never exactly straightforward and simple. It's rather a little long-winded, but it requires a lot of thinking and a lot of choices to make, many of which are not part of the standard retinue that are taught Western medicine doctors. Now, unfortunately, in the country, Lyme disease does not occupy a very strenuous place in recognition by physicians. Most Western physicians, if they're not trained in holistic medicine, they're very uneducated when it comes to Lyme disease. And as far as we know, it's spread just about in every state in the country, and it's in every continent in the world. Almost every country reports cases, so that it becomes a major epidemiologic problem that, for the most part, goes unrecognized. Now, there are many theories about this, which I don't want to go into. We can't prove them, but those are the facts right on the surface, and they're very formidable to the patient because many patients have this disease which go unrecognized by the medical community, hospitals, and specialists, and they're eventually referred to psychiatrists thinking that it's all mental. We have evidence to show that in the area that I practice in Eastern Massachusetts, there are some psych hospitals reported by psychiatric nurses, which tell us that 60% of the psychiatric patients in the hospital are there because of chronic Lyme disease. And this is a well-known fact. It's something that is astounding to the medical profession, but if it's accepted and worked on, it could be ameliorated very easily. Now, in the area that I practice, it's a very indigenous area of Lyme disease. New England, the Northeast, the entire East Coast, the Northern Midwest, and the Northwest Pacific from Northern California onward up. That's where a lot of the cases emanate. The tick is usually inhibited in the winter months, but comes out in the warmer weather. In dry, desert-like conditions, there are fewer cases. However, there are reports even in Arizona, in the north rim of the Grand Canyon, they have found some infected ticks there. No cases. Very few people live there along what's called the Vermilion Cliffs. But it just goes to show that even in desert areas, there can be some transmission. And there are certain people that travel to these desert areas from other more humid, moist areas in the East Coast and the South that bring Lyme disease with them. One of the things that we noticed is that when people are screened for Lyme disease randomly in primary care physicians' offices, this is what we're getting from primary care physicians that refer cases to us. They're getting between 20 and 30% of all cases have antibodies, and these are the tests that are done by the standard medical labs like LabCorp and Quest, which are only 70 or 80% accurate. They're not as accurate as some of the more specialized holistic labs like IGeneX or Infecto labs, which get a higher level. In terms of what the CDC and the NIH elaborate in their understanding of Lyme disease in the country, they say there are about 300,000 cases per year. But being that Lyme disease is underreported, underrecognized, and it's really a vastly unknown phenomenon in many medical situations, you can double, triple, or even multiply that number by 50 or 60, and you're getting anywhere from 10 to 20, 30 million cases per year at any one time in the United States. So it becomes a very formidable problem in terms of treatment and recognition. The treatment avenues basically can be broken down into holistic as well as Western medical. Most people that treat Lyme disease use a combination of both Western medicine antibiotics as well as holistic forms with herbs, energy treatments, or other forms of treatment. It's important to recognize that the more you add to an individual's compendium of treatments, the faster they will get over this disease. Now, this is an infection caused by a spirochete, Borrelia burgdorferi, which has many different strains. And one of the problems is not all the strains are tested for by the diagnostic labs, so you can miss. It's not uncommon to have negative testing, even with a very close clinical presentation, which is diagnostic of Lyme disease. so that we go ahead and treat anyway if we see that somebody fits in the clinical criteria pretty closely. There are very few other diseases in this part of the country that can produce the array of symptoms that Lyme disease has.
Yeah.
And the major triad is chronic fatigue, arthritis, and brain fog. You can add something called neuropathy to that, chronic pain syndromes, but that's probably it. There are some people that get acute Lyme disease, which causes acute meningitis that have to be hospitalized, or acute cardiac involvement, which has to be hospitalized. In the past, that we used antibiotics widespread in almost everybody, but over the years, new holistic methods have appeared, new approaches, new agents have been presented to us, which have had equal, if not better, results than the antibiotics. And there's nobody with Lyme disease that gets over this in 2 or 3 weeks or a month or two, especially if they're not treated. Even with the best of treatment, it takes a considerable period of time. We're talking about 2 or 3 months, 6 months. We find that the younger they are, the shorter the period, the older they are, the longer it takes. The more underlying diseases they have, the longer it takes. And if they do combination of treatments, the course is usually quicker. Lyme disease itself is associated with co-infections that the tick, the Lyme tick, the deer tick, which has a special name, carries with it in terms of transmission of additional diseases. There's the basic Lyme disease, and then there are 3 other diseases which can be contained in the same tick bite. And one is called Babesia, which is like malaria. Another one is called Bartonella, which is like cat scratch disease. And a third one is called Ehrlichia, which is like Rocky Mountain spotted fever. These all have distinctive patterns, and about half of the patients have these co-infections. And only half the time of the co-infections predominate with symptoms, but they have to be tested for, unless you have a general all-around treatment that is able to treat both the co-infections as well as the Lyme disease itself. So what we do is we try to have patients see Lyme literate doctors that have had training and expertise with the Lyme disease, so they know exactly how to treat this to the end stage. Many studies have been shown that chronic Lyme disease, untreated and managed poorly in terms of not eradicated completely, can produce many long-term manifestations, mainly neurologic, such as Alzheimer's disease, MS, multiple sclerosis, ALS, lupus, which is an autoimmune disease, lupus erythematosus, rheumatoid arthritis, and Parkinson's disease. And anybody with these in chronic fatigue, anybody with a combination of these diseases or who presents with this, especially elderly, should be screened for Lyme disease. Very, very important, because you may not be able to reverse disease, but you can stop the progression of the disease and halt the damage in the body, especially neurologically. And it's very, very important to be able to do this. So we have our hands.
Dr. Gurgler, I had a question going back to, you mentioned earlier about half of the psychiatric patients you believe have Lyme. Can you talk more to that and how that presents as these neurological issues that might put someone in a psychiatric hospital?
Well, if you speak to a lot of patients who have had chronic Lyme disease that's documented, you see that many of them have had chronic anxiety, insomnia. Some become paranoid, especially at the beginning. There are some that get acute psychosis. It's unusual. It's not the common thing, but it does happen. And unless it's recognized and dealt with directly, it can be misinterpreted as strictly on personality or psychological, emotional basis. It's very important to understand that there are some things like Lyme disease which can do this. There's also one of the co-infections, Bartonella, which is cat scratch disease, which can cause aggressiveness, temper tantrums, flows of anger, which are unexplained. And these also can contribute to a change in the personality. Personality changes are seen, not uncommonly, in Lyme disease. Rages, what we call Lyme rages, are not uncommon, and they're usually seen in one of the co-infections, Bartonella, and chronic Lyme disease itself. So this is part of the whole package, and it has to be understood that it's a disease with many manifestations. And people with these things, especially if they become unexplained, they appear out of nowhere, should be screened for Lyme disease. It's very, very important.
What is the process for accurately screening Lyme disease? Is this something you do in your practice, or is this wide known?
Yeah, we do this all the time. There are companies, labs. First of all, the standard medical labs have Lyme screening tests. They have it's called the Western blot antibody test, LabCorp and Quest. Just about all hospitals and doctors have ability to contact and do this, but you have to remember they have to think of this first and have this on the tip of their mind so that they do get the test done and do enable a patient to have a diagnosis. But some of these screening tests aren't as accurate as they could be simply because they don't accommodate all the strains of Lyme. There may be 20 or 30 different strains of Lyme disease working in any one area. They don't have all these different antigens in their screening criteria, so they may miss some. The best tests are done by a company called IGeneX, which manifests its function is to deal mainly with Lyme disease and the co-infections and the other manifestations of it. And they've been devoted for this for maybe 30 or 40 years. They're in California. There, they have a test called an immunoblot, which is about 90-95% accurate. The standard Western blot done by the standard medical labs is perhaps 70-80% accurate, and that's all. So you can really miss a lot unless you know what Lyme disease can cause and you're willing to pursue it further. You may miss it entirely, but you have to realize this is not a strict science the way many other things in medicine are, because it lacks the focus and the emphasis and the national recognition that it deserves. There are other tests that we do that are blood tests. One is called a natural killer lymphocyte test, which is designated as a CD57, which can also be helpful. It's manifest only in Lyme disease. Apparently, Lyme disease is one of the only diseases that can lower the counts of this CD57. And there's another test called a Lyme iSpot Lyme test, which is done by IGeneX Pharmacy and a newer lab, which has come to this country in the last year or two, called Infecto Labs, which has probably the most accurate test for this iSpot Lyme. So the problem is many practitioners don't know about these tests, and they're told that the testing is not very accurate, so they shouldn't do it. But they overlook a very, very important feature to do this for patients. It's very, very important. And we know this for sure, that even with negative testing, it should not deter a physician to manifest treatment criteria for any one patient as long as it looks like they have a close clinical fit. Because to ignore Lyme disease and not treat it when it's present is a major blow to the patient, because it can result so much disability long-term and chronic manifestations neurologically, which can be avoided early on before the 10 or 15 years of involvement. Okay.
I have a question. Is there a way to actually prevent getting Lyme disease, even if you're bit by one of these ticks, or like Lori was saying now in some of the low mosquitoes?
Well, this is unlike other infectious disease where elimination involves separation socially, like coronavirus. Once you've had a tick bite, you can analyze this tick with a local state laboratory, and that's very, very accurate. And you can wait on treatment. If it's positive, you can go ahead with treatment. But most of the time, we don't do this because it delays treatment decisions. we go ahead and treat anyway. There's really no knowing after a tick bite unless there are fevers, the
Bullseyes.
erythema migrans, the bullseye rash, or other things which denote acute disease. Many people don't get this, so you have to make a decision on a clinical basis, empirically, whether to go ahead and treat or not. So that we generally, if somebody's had a tick bite, we just go ahead and give them standard remedial treatment as if they did have Lyme disease. But it's got to be done correctly with the right criteria.
So if someone got a bite and they started on the LymePlexPLUS, which we'll talk a little bit about more later, is that a good mode of pursuing forward, or is that only part of your protocol?
Well, it's only part of the protocol. It can be used, and it certainly is effective, but it doesn't have the practice and the study that other methods have had. This is one instance where I would resort to Western medicine because it's been tried and true and proven. We usually use a few different antibiotics, one at a time, for 3 weeks in any one tick bite. You can add LymePlexPLUS to it. There's also a tick bite kit, which one of our local naturopaths has formulated, which has essential oils in it, which can be applied even a few days after the tick bite, which is very effective too. But it's not widely known, and it's only available to the people that know that it's in existence around here.
Okay.
But usually 3 weeks of antibiotics and LymePlex.
So if someone had something like this kit, they would carry it around, and if they felt they had a bite, they could use it, and that would help?
That's right. That's right. The best way to avoid having tick bites is, of course, using before you walk in nature, where you're exposed to a natural element where you know that there could be ticks, is to use tick spray. And there are several brands that are very good, have multiple essential oils in them, such as Nantucket Spider or Tick Ban. Using a tick spray with only 1 or 2 ingredients is usually not strong enough to inhibit the ticks. You really have to use them with 5, 6, or 7 combinations of essential oils, and then it really does work. These are tried and true. They're proven. They last about 4 hours, and this is really absolutely mandatory in areas that are infested with Lyme disease, like the Northeast, Northern Midwest, and the Northwest.
Okay. So you said Nantucket Spider or Tick Band? Is that what you called it?
Yeah, Tick Band.
What are some of the oils that are in there that you know of?
Well, they have red cedar oil, lemon eucalyptus oil, and others. Some of them have garlic in them. They don't smell too bad. Smell disappears after a while. And they have to be used on all skin surfaces, inlets, sleeves, cuffs, around the waist, around the shirt, the buttons, and head and face, neck, around the wrists. Anywhere a tick can get infested and bite that's exposed to the skin. And
I think we need to talk a little bit more about the difference between chronic Lyme and the first diagnosis after a fresh tick bite, Art. I think we can talk about how the antibiotics have not been very effective for chronic Lyme, and where LymePlexPLUS has stepped in and really produced miraculous results in some of the patients.
Yes. Generally speaking, most of the people that we see have chronic Lyme disease. Acute Lyme disease can be recognized. Some of the hospital emergency rooms around here and in the country do know this, but they're not fully adept on the length of treatment with antibiotics. We usually recommend 3 weeks of antibiotics for an acute tick bite. Many places just recommend a week or 2, and it's not long enough, so you don't know if you've completely eradicated the disease or not. In terms of chronic Lyme disease, that's usually something after 3 to 6 months, and it's very, very prominent, very common in the New England area and the East Coast. That usually requires combinations of treatment. Initially, we used antibiotics. Many people still use them, but the problem here is side effects and producing a silent Lyme disease, which is still present in the body. There's thought to be approximately, through studies, 30% resistance in the use of antibiotics for any type of chronic Lyme disease. Now, unless you realize that this is the case and you test for the activity of Lyme disease after a full course of treatment, just because somebody's become asymptomatic doesn't necessarily mean they're over the disease. It can be produced silently, what they call post-treatment Lyme disease, and it go on to manifest chronic neurologic problems many years later on in life. There was a study once done at Harvard in the 1990s that showed that 17 out of 23 cases of Alzheimer's disease were associated with positive Lyme antigens in cadaver brains. And none of these cases had evidence of acute clinical or chronic clinical Lyme disease in their case histories. So this is what happens if you treat with antibiotics. You don't know which of the 1/3 to 30% that become resistant, but become silent anyway. And there's a whole lot of people, at least 30 to 50% of chronic Lyme disease is silent, which means that in indigenous areas, probably everybody entering a medical practice ought to be screened for Lyme disease. Almost everybody. It's very, very important.
How is it transferred? Just like a virus?
There's very little physical transmission. It is in families and close physical contacts. It's been found through sexual transmission, but it's not as flourished. It's not as frequent as sexually transmitted diseases. They have found spirochetes in people with Lyme disease in semen and in vaginal secretions, but it's not as common for it to be transmitted that way. It does happen, but close physical contacts over long periods of time, people living together are the ones that we're concerned about with Lyme disease. When we see one family member, we recommend that everybody living in the house, every other family member, be screened for Lyme disease to be sure we understand the whole sequence of the disease in one area. It doesn't spread on droplet infection. It's got to be close physical contacts, usually body secretions are what they think is what spreads it, okay? But it's not something where we give safe sex advice or we keep people in isolation for it, because the type of spread physically is not as great as other diseases like influenza and flu and some of the other infectious diseases.
Okay.
But treating chronic Lyme disease is a big problem. You can use antibiotics. They're good, but there are many, many other things that we resort to. And here is where knowledge of holistic avenues of approach is very important. For example, we would use Rife machines, which are energy machines with specific frequencies for Lyme disease. We would use ozone, either rectally or in a steam sauna tent. We would also use a very, very effective supplement, which has been shown to be extremely effective for Lyme disease, called LymePlexPLUS, which I've had the pleasure to be introduced to by Lori a year and a half ago, and it's proven to be as effective, not more so, than almost any other type of treatment. Biochargers.
And tell us, okay. Tell us more about how you've seen the LymePlexPLUS work.
Well, initially when I started using it, I wasn't sure how good it was going to be, and I had my doubts because everybody likes to promote their products. But I noticed that within 2 or 3 or 4 weeks, in the people that started using it, they were getting a reduction in symptoms about 80%, which is unlike almost every other type of treatment approach you can see with Lyme disease. And almost everybody that I've treated has become silent. In other words, it's reduced all the symptoms to zero in a matter of anywhere from 5 to 8 months as the sole treatment. We also put people on special diets, and we give them supplements to strengthen their antioxidants, their detox, and their immune system. So I haven't found any other supplement that alone can do this. Usually it's combined with many other types of things, ozone, rife machines, antibiotics, but this alone seems to be very, very effective. We've had a few patients tested to see whether there's been biochemical proof that the Lyme disease has disappeared, and they've both been negative. So it shows very early on now. I have about 60 or 70 patients on this, and we're going to be testing every one of them, but just about 98 to 100% response in terms of becoming silent. And here, we don't suspect that there's the level of resistance that we get with antibiotics. We feel that this is probably going to remediate the entire disease. And it's also good for the co-infections, as well as yeast infections, which are very often present in association with Lyme disease because of past treatment with antibiotics, which stir up the colonic biome. And I might add that unlike antibiotics, this works through the gut biome as part of its immune stimulating effect. It does not alter it like antibiotics do. 60% of our immune system is located in the gut. And when you disturb this with antibiotics, kill off the good bacteria, you're impairing your partial immune response, be able to kill off the Lyme spirochetes. So this only stimulates that, and it doesn't have any deleterious effect like other forms of treatment do. We often combine supplements with this, and we can use ozone with this. Antibiotics seem to inhibit it, so we don't like to combine antibiotics with LymePlexPLUS. A LymePlexPLUS alone, along with a special diet, can do the job, and it's done the job very well in many cases.
And just to touch on briefly, what are some of the food plans or diets that you recommend for those who've experienced?
Well, the basic diet is what we call a candida or a low sugar diet. It's what you use to treat yeast infections, but you can have yeast, but the problem is products that are fermented with yeast like mustard, relish, ketchup have a lot of sugar in them. So you pretty much have to stay on what they call a candida or a yeast-free diet. This is refined sugars, all the desserts, ice cream, cookies, cakes, pies, puddings, the sweet sodas, dairy. You can have sugar-free milk or lactose-free milk. You can have the sugar-free almond milk or soy milk or things like that. And pasta and breads can really be severely limited because they're digested very quickly to sugar in the body, and it's like having a dessert. So you can have a bite or two of bread or pasta, but you can't have a full portion of this. People with Lyme disease, when they cheat and they have big desserts, they find many patients find the following day they feel much sicker, they feel hungover. It really stimulates the neurotoxin that the spirochete stimulates in its production. The spirochete itself only reproduces once a month, so it's not because of an increased load of spirochetes, but it's because it's producing more toxins, which really cause a lot of symptoms.
Right. Okay.
And what was exciting that I wanted to mention was when we added the spray, correct? The mind fog. I mean, almost instantaneously, within minutes, we had even one of your associates, their mood fog lifted. It was miraculous. It just didn't seem like this could be possible, but we've consistently had these results, and long term, their cognitive abilities, are coming back. You might want to talk about that. I mean, it goes right through the blood-brain barrier. And I know with my son, and many people that I've talked to, anxiety, depression, the anxiety seems to be one of the toughest. I mean, some of these kids couldn't even listen to music anymore. One of our customers used this, and within the first week, he was able to put headphones on for the first time in 5 years. So we know this is breaking through the blood-brain barrier and doing some amazing things. I mean, it was used for years for migraine headaches, and it reduced and actually eliminated in 98% of the people migraine headaches and allergies. So
So,
this is
Lori,
why I'm excited.
give us, Lori or Dr. Gurgler, give us some examples of how it works and why it works. What is it what's so special about it? About LymePlex+.
Well, number one, what's so special about it is the clinical experience in using it. I've never seen something as effective as this, number one. Many times patients take antibiotics, they get side effects chronically, and they give up taking them after about 6 months. And they come back to you and ask for an alternative method that's more natural, that doesn't upset their stomach, doesn't cause, sometimes they get joint pains from them, doesn't cause headaches or allergies, or doxycycline, for example, is very common to have sun sensitivity, photosensitivity. And I have some patients that even in the winter, and they're driving in their car and the sun is coming through the windows of their car, they get sun rashes. So the antibiotics do have limitations. What we like about LymePlexPLUS is the fact that it does not have any perceivable side effects other than a die-off reaction, which almost everything has when you treat Lyme disease. It's called a Herxheimer reaction. Usually comes on a week or two after taking it, and it can last a week or two and exhilarates. It exacerbates some of the underlying general symptoms like fatigue, headache, little brain fog, and then goes away. It's very unusual with LymePlexPLUS that you have to stop this because of the Herxheimer. The older people get more Herxheimers than younger people, so you have to be careful and sometimes reduce the dose. And another thing with treatment of Lyme disease is you have to individualize. Each case is a separate case. Each body is different. You have to have some method of evaluating the body individually so that you can see that they accept it, they can adapt to it, they can tolerate it very well without getting unusual reactions like a very strong Herxheimer reaction. LymePlexPLUS is a fermentation product with amino acids, proteins, peptides, and enzymes. But I think that in conversation with other practitioners and with Lori and some of the other people using this, we can't explain all the ability of LymePlexPLUS to be as effective as it is just from the components. There's a whole sheet of analysis on it. If somebody's interested, we can give you. But there seems to be some sort of component of energy mixed into this, which allows it to be as effective as it is. Without this concept, I don't think you can explain it as well, because many body secretions, saliva, GI secretions, stool, colonic secretions, nasal secretions, have similar components, yet they have no effect on Lyme disease. So there may be some special component of energy imparted to this in its manufacture, which is very, very important. But at any rate, we have a supplement here which does not have to be given with 3 or 4 other things. It can be used alone and support with supplements to support the antioxidant system, the detox system, the immune system, and other things, and the bowel, the colonic flora. This does not deter any of those. And the wonderful thing about it is, with antibiotics, for example, you have to use 2 and 3 antibiotics concomitantly, each with a different set of side effects and effect on the colonic biome. Here, you're not altering the colonic biome at all, and you're just using one really supplement combined with other strengthening supplements to help the body. So we like.
Yeah, it sounds great. And I don't know if it's relevant, but could the LymePlexPLUS help people just boost their immune systems with what's going on now with the scare of, different viruses and flus and different things like that going on? Does it strengthen the immune system?
Lori, you want to address?
Art, can I jump in just for a minute? Yeah.
Sure.
So for 12 years, we had extensive research and testing with doctors, not only quietly in the United States, but also overseas and down in Mexico. And the entire focus was on autoimmune disorders and infections. We had yeast infections remedied in one night, vaginal yeast infections, one bottle. got rid of lifelong candida, or as Dr. Gurgler always corrects me, candida. Allergies were gone. This is truly something that it creates an environment in the body where the immune system really is able to take over again for the first time in years. It assists it almost like in resetting. So it creates an environment where the immune system can do what it can do. For me, I had osteoarthritis. I had a total hip replacement at 54. I have not had to have another one, and I was well on my way to do it. We had rheumatoid arthritis patients that it did such miracles for that within the first week or two, they went off of heavy pharmaceutical pain drugs. We have many cases of psoriatic, rheumatoid, and osteo that were remedied. These are autoimmune disorders, obviously. And most people that know anything about Lyme disease are well aware of the fact that as the immune system gets so traumatized and taxed by trying to eradicate the bacterias and those spirochetes, that the autoimmune disorders start to worsen. In fact, they start to develop. It's called the Great Imitator. People get diagnosed with lupus. Like I said, my children with celiac, with rheumatoid arthritis. That's one of the most common. With lupus, with Parkinson's. I mean, it's happening all the time that these people are getting diagnosed with autoimmune. So for me, it worked wonders. I no longer suffer with chronic bronchitis. Many of my family members have been helped by this and their immune systems put back online. A very common feedback that we get from our customers is these Lyme patients are terrified of colds and influenza because it would take them down for very, very long periods of time. It affected them far worse than a normal, healthy person. What we're hearing and the feedback we're getting is that many of these people are no longer getting sick when their kids bring the colds and flu home. So we have an idea, and we all know that the people that have been suffering the worst with the coronavirus are those that had compromised immune systems. So being a layman, I'm just putting two and two together, and I would assume Dr. Gurgler might have a little more medical feedback on that. But it was actually an accident that this was discovered for Lyme disease. All I could do is look at my symptoms. Then when I found out how sick my nephew was, I'm going, geez, some of these symptoms are similar. And I sent him a sample. And miraculously, and I say miraculously because it doesn't happen with anybody, within 10 days, he was back to working 12-hour days when he had been barely able to get off the couch for more than 2 to 3 hours a day. Today, he is still working full-time, 18 months later, running his company. So have everyone gone asymptomatic in 7 to 10 days? No, but Dr. Gurgler described exactly why that is. My nephew was younger. He was 36 when he started this. He had no co-infections. He had been had tested. But what we do know is the body is able to go back online for a majority of the people. The immune system is able to get ahead of these autoimmune. But Art, you might want to expound on that a little bit medically. Again, I'm not a doctor. I've been studying more than ever what this disease has done. This is a true pandemic. I've done enough research, to see we're headed that way. And it's not getting the attention of the coronavirus, and people are working very, very hard to change that.
Dr. Gurgler, thanks.
Yeah.
Sure. Art, you want to talk a little more about why we believe that the immune system with the microbiome? I guess you did cover that. I mean, it's very active in I had colon polyps. I've not gotten any more since I've been on this. My gut health has been normal. I mean, I had been diagnosed in the past with irritable bowel syndrome. That's gone. I think Art could tell you a little bit more about when you have a healthy, intestinal tract or microbiome in the gut.
How does it help with the intestinal tract and the microbiome?
Well, we don't have studies to show it, but we think it does because there's no effect on the gut in which there's any deleterious effect like killing off the good organisms. And there's never been a case of yeast overgrowth because of LymePlexPLUS. So we know it does not have any deleterious effect on the gut. And we think that because it works with the immune system, it has to work with the gut because this gut has the majority of the immune system in it. It has 60% of the immune system. And unless if you're involving something which can stimulate the immune system, that means it's really got to be part and parcel of the gut biome to enhance it. And this means that when Lyme disease takes effect, it starts as a neurologic disease and then gradually it spreads to cause what's called a leaky gut or overgrowth of the gut. It doesn't cause any damage or inflammation there, but it does grow there and it seeds itself as a reservoir for chronic infection. So if you can work with the colonic biome with something and destroy it that way in the gut, you can prevent a lot of progression of this disease. As I said before, many of our chronic autoimmune diseases can be associated with Lyme disease because we know it does cause a lot of autoimmune diseases. This has been known for years, such as lupus, scleroderma, a lot of the chronic neurologic disease. These people all have to be screened for Lyme disease to get adequate care, to get to the basis and the underlying cause of what their disease is. You may not be able to reverse it, but you can stop the progression if that does turn out to be Lyme disease. And as I told you, one of the studies showed that a much greater 80% of the Alzheimer's disease in the Boston area at a Harvard study had been associated with Lyme disease, Lyme antigens. So we know that this is a very, very common cause of chronic neurologic disease, Parkinson's disease, Alzheimer's, MS, ALS, lupus. All of these diseases have to be recognized as being part of the Lyme disease spectrum. If there were a national research study through the NIH, many medical schools, this could overturn everything. We could have an answer to this, a vaccination and treatment overnight. It's only one disease, it's one infection, and it can be handled that way with the proper research and recognition. But there are a lot of factors against this. A few months ago, about 5 months ago.
Supplement.
That's right.
We're in the food category. We're in compliance. We've been trying. Dr. Gurgler has case studies. We actually have tests that prove what it does. But we have been having an extremely difficult time finding, first of all, getting people to believe us. It's like before penicillin. It's literally in the same category as the breakthrough as penicillin, both deeply fermented. We have the capacity to produce this in mass, so it doesn't have to be synthesized, unlike back when penicillin was put into a pharmaceutical form for World War II. It's that much of a game changer, and we've been trying to bring on organizations to fund this, but like with any breakthrough, people don't believe you right away, but word of mouth is getting around. And heroes like Dr. Gurgler that won't give up, that was willing to test it. Foundation directors like Michelle Cloutier-Miller at Central Mass Lyme. She lost her mother from this disease. She believed me enough in my passion and sincerity on what it had done for me and my family that she introduced me to Dr. Gurgler. They're the heroes. I called many foundations that wouldn't even, Lyme groups, Lyme foundations in other states, that wouldn't even return my call, period. And I get that they've had people saying they had cures, but this organization was created, this company was created in order to, in fact, it was created in a nonprofit formula initially owned by Trust. And our goal is to help the people that are suffering. That's why we're excited about creating a holistic approach to this. We've got average 85-95%, even with people that have Borrelia and Babesia and ehrlichiosis, am I saying that right, Art? That
Yeah,
have these co-infections, going back to work, neuropathy gone. But I'm not going to leave the ones behind that still have the 15-20% yet to go. So now we're starting to do some studies. We do have a clinical study starting in California with the bioenergy machines. The bioenergy machines are incredible. The Rife technology is done well, but it doesn't bring them completely to conclusion. But we are learning that when you put these together, we have a good chance. So we do have a clinic that's doing a trial out in California with the bioenergy medicine, and we have a lot of holistic practitioners that are testing this. And they're the ones that are sticking with it, that are looking at the diets. We discovered most, and Art knows this, most of the Lyme patients cannot handle heavy metal detoxing. But yet Lyme disease patients get sicker from heavy metals in their system because their immune system is compromised and overtaxed. So once they go on the LymePlexPLUS for a while, and hopefully even speedier, more efficacy with the bioenergy machines, they'll be able to handle a heavy metal detox, and we can bring them 100%, or at least as far as we possibly can. And we've got a group of doctors, over almost 30 now, that are following in Dr. Gurgler's step, that are trying this with their patients, and dentists. I got rid of an abscess tooth in a little over a day with this. When we say it's a breakthrough, safe, fast, and effective, it is. But are we going to go start advertising it for the coronavirus? No, we're not going to take advantage of people's fears. We're going to allow the doctors that are using this, who already figured out, obviously, that it helps with the immune system from actual results, share it with their clients.
And so is it the same like dosage for different people? You know, if they're sicker, are they taking less so they can get used to it? What
Well, for years with the autoimmune disorders, the typical dosage that was used in these case studies with the doctors was 1 teaspoon a day for the first 4 days, and then a teaspoon every other day. And that was used for years. Some with the advanced autoimmune disorders, or with rheumatoid arthritis that was crippling, they continued to use it for a few months longer than some of the other ones. But what we found with Lyme disease kind of shocked me. With my nephew, for instance, we started him out with 1 teaspoon a day, but when he went down to a half a teaspoon or a teaspoon every other day, he said, Aunt Lori, on the days that I'm not taking it, I'm kind of feeling more fatigued. And so I talked to the doctors that were working with it, and they upped his dose so that he was taking a teaspoon and then a half a teaspoon every day, and he had those remarkable results. But listen, these holistic and integrative doctors know their patients. They know muscle testing. They know how to communicate. They've been doing this for years. That's why my hat's off to the holistic community, because they actually approach this with their clients in a far more holistic manner, meaning taking their feedback as well. And so they have the expertise to be able to muscle test their individual patients. So generally speaking, when we have some that do tend to get infections, the doctors sometimes will up them to 2 teaspoons a day for a couple of days. So Art, you can talk a little bit more about this. You're the one who's leading the way with this and teaching the other doctors what you've learned.
right? And I'd love for you to mention a little bit about the Herx that you were talking about, as well as, like, I remember Lori and we talked, you were saying that you can't really overdose on it because it's all natural and your body will.
No, there were intensive studies done with this, done at the University of Mexico. And of course, when they're doing studies, they give them very, very high dosages. And it was when the reports came out from the labs, the chemistry labs, it was shown there is nothing that you really can overdose with on this at all. There are no known side effects or interaction with pharmaceuticals or other supplements. None ever reported.
Let me introduce something here. That
Yeah.
the important point that we made before is that not everybody is the same. Not everybody reacts with the same degree of detoxification, metabolism, handling of their immune system. Everybody's different. And you have to employ methods that individualize, that discriminate. The people are going to have a difficult time with the standard dose. First, the ones that need even higher than the standard dose. You use muscle testing, aura testing, pendulum, whatever biomeridian machine. But the average dose that I've found with Lyme disease that suits most people is 1 teaspoon twice a day. This is really what most people are able to tolerate. Very old people can get lower doses. Some people have to have a half a teaspoon every other day. Very young children, of course, it's got to be modified much lower down because of the smaller size. So you have to really remember that the dose is very important, but if you go too low, you're not going to have the full effect of it, and it's going to take a lot longer. What's very good to know is that there are no interactions with this except with antibiotics, because antibiotics deplete the biome in the colon, and they minimize the effect of LymePlexPLUS on the colon and diminish its effect. But other than that, it's really compatible with all other drugs and all other treatments. And we find that energy treatments, such as Rife machines, biochargers, I have something that's a modification of a biocharger that we call a noble flame. It's very, very powerful. It's probably 50 or 100 times as powerful as the standard biocharger that's been manufactured on the market. And it's very, very, very good to shorten the course. We find the average course with LymePlexPLUS, doing everything right, is about anywhere from 5 to 6 months. With the energy machines, it can be reduced to 5 or 6 weeks or 8 weeks. So it can really make a big difference when you add in energy therapy and other forms of treatment that are not deleterious, that don't have side effects. So people have to know about this. They have to know they're available. The older people, when it comes to heavy metal detox, as Lori said, this is not something we do right away because you can get a little bit of a detox crisis from this. We don't want to add this to the symptoms of chronic fatigue and brain fog that the Lyme patients already have. So we usually add this in later on, but as soon as you achieve a level where you can remove the mercury, the lead, the aluminum, cadmium, arsenic, these are the things that really impair the working of the immune system, and they're very easily removed from the body by different protocols. When these things are removed, suddenly the patient starts getting much better, much quicker than before. And this is very important to do with almost everybody.
Is that what?
The other thing I have to mention is that just because somebody gets a good effect from either antibiotic or LymePlexPLUS or any other methodological approach to Lyme disease doesn't mean they're cured. And we have to be sure that we remember to treat somebody, have them do blood tests that show that the Lyme has been removed from the body. There's no activity, activity of the immune system towards Lyme antigens at all. And then we can conclude that treatment is over with. But even in the best of hands, this may take anywhere from 3 to 6 to 8 months.
And so the heavy metals, is it the LymePlexPLUS that's helping to detox the body from it, or in combination with the energy medicine you're talking about?
Well, heavy metals has their own protocol approach, and it's I don't know if LymePlexPLUS manifests that, but you have to add special agents. We can do intravenous if it's really very serious, or we can do something called ED. These are synthetic amino acids, EDTA, DMSA, and they're usually used for about 3 months. They're very well tolerated. They're not started right away along with LymePlexPLUS because this can be a burden to the body, can cause Herxheimer's, and we don't want somebody getting too tired and too weak and having their symptoms flare a little. You don't have to do everything at once. You have plenty of time to treat them. But as long as it's remembered and approached. It's very important. And heavy metal was one study that showed that when you remove heavy metals completely in a form of treatment called Chelation Therapy, which is intravenous, it's usually 20 treatments once a week, you can reduce the level of future cancer of all types by 90%. So heavy metals not only impairs the immune system, but impairs chronic diseases of all types, cancer, Alzheimer's, MS, Parkinson's, heart disease. So it's very important to remember that this is a big component that inhibits the action of the immune system. You need every bit of activity of that immune system to fight the Lyme disease that you can manifest and free it up. So we have to know about doing this. And sometimes we also do diet detox programs, diet detoxification programs, 2 or 3 weeks after Lyme disease has already been treated for a month or so when somebody is over their Herxheimer's, because this removes what we call xenobiotics, foreign chemicals from the body, which in this country, because we don't have an organic diet, everybody's loaded with these. They also impair the immune system. People who do a diet detox with Lyme while they're on treatment often get much better and much stronger afterwards too.
And tell me a little bit about kind of, I know for myself, when I took it, I mean, it really helped to lift the brain fog, and I took it more for autoimmune issues rather than Lyme. And I didn't have much of the Herxheimer's or die-off. Can you kind of give us a range of like worst case scenario to best case scenarios, people's reaction to this? Like, for instance, I didn't have any negative symptoms from it, but some people do. And so what can you say to that to where they don't give up on it because they're starting to feel some of this die-off?
Well, one of the things that we do initially when we evaluate somebody to start on with LymePlexPLUS is to see if they are susceptible to having a serious or severe Herxheimer reaction, a die-off reaction. If they are, we modify the dose immediately. And if somebody does happen to have this and we couldn't predict it in advance, we can either cut the dose in half or we can eliminate it, let it pass over and restart it at a much lower dose, so there's much less likelihood that it'll reappear. Once you've had a Herxheimer reaction to one form of treatment, you don't usually get another one, even if other agents are added. It's much milder. So it's the first one. And many times it starts after a week or two, not right away, not as soon as you start the agent, but it starts a week or two, lasts a week or two, and that's about it. With some of these energy machines, I've had experience using this Noble Flame. We had a few patients have Herxheimer reactions lasting a month, which is, it shows how powerful the machine can be. But you just have to be careful, test every patient with whatever subjective form of energy testing you do, and make them aware that they can have a Herxheimer and to contact you if it gets too severe. Because one thing is Lyme, and the Herxheimer reaction can make it a little worse at the beginning, but it's usually with LymePlexPLUS, I've had perhaps one patient where I had to stop it and restart at a much lower dose. It's much less apt to cause a severe die-off reaction than antibiotics or other forms of treatment. And there are maybe a list of 12 or 15 different supplements: vitamin C, selenium, vitamin D, all sorts of things, activated quercetin, which we have used in the past, are promoted for Herxheimer reactions, but very rarely do they really work well, because you're dealing with a reaction that involves half the weight of the body. The immune system is probably a third to a half the weight of the body in terms of half of the blood, tissues in the colon, and you can't just turn that off with a few doses of herbs. So you have to stop the original cause of it. Mm-hmm. But it's not a problem with LymePlexPLUS. It causes mild herxes compared to some of these other things. That's why we like using it so much.
Great.
But if you didn't get a herxer, maybe 90% of people get herxes. Because you don't get one doesn't mean it's not working. It just means biochemically, genetically, you're not susceptible to getting it.
Right.
Non-infections, diseases which are not caused by infectious agents do not produce Herxheimer. It's only infections, things like syphilis, candida, mold and chronic mold illness, Lyme disease produce Herxheimer.
Mm. Yeah, for me, I mean, it brought back my energy and like lifted the brain fog. Those were the most significant things that I noticed, and why I was started to take it is for, and I've got a clean food plan. I'm a holistic health coach. Everything I eat is pretty darn clean. And the amount of fatigue I was experiencing, I never did do the Lyme test. That wasn't, this is the first that I've heard that all of these things can really be pointed back to Lyme disease. That's fascinating. I had no idea.
Well, we try to do everybody to get documentation that they do indeed have Lyme disease with testing for research studies, population epidemiology studies, and many times the insurance companies, when they apply for disability or the state disability, they have to be able to prove they have Lyme disease. So we don't do it on everybody, but almost everybody gets it.
Wonderful. And if anyone is in the room, you're welcome to type a question to Dr. Gurgler or to Lori or to myself. If you have any questions, go ahead and put them in the chat, and we're happy to answer any questions. Wonderful. Let's see what. So Lori, how did this come about? You said it was by accident? Finding
Well, yeah,
LymePlexPLUS?
it was intuition. I don't believe there are accidents. It seemed like a logical thing to do when I found out he was so sick, and some of his symptoms were, I am 99% sure I had Lyme disease myself. I just had never been tested before I went on this. I developed many of the symptoms. I had a very large engorged wood tick removed from right at the base of my spine on the back of my neck when I was about 10 and a half, I guess. And at 11 and a half, all of a sudden, I started to suffer with anxiety and depression. And I mean, I thought maybe because I had gotten my menstrual cycle, oh, that could be it. But onset was so quick. And for years, I suffered with it. And my God, since I've been on this serum, I have been so much more stable. I don't get that severe anxiety anymore. And I do not get any bouts with depression like I used to get. And that's very common feedback. The longer we've had people on this, it's more and more common that the anxiety drops away. They're not getting as depressed. There's a lot of psychological like Dr. Gurgler said, these people are very weary because they were told they were crazy because they weren't tested positive. They're put on all kinds of psychotropic medicines, told they have bipolar disorder, told that they have, well, we could go on and on with the DSM, but anyway, once they get on this and these spirochetes start getting extracted from the brain and neurons start functioning normally again, it's just been really exciting to stay in touch with the people that are on this and see their recovery. I mean, you can have no idea. My husband didn't take it, even though he saw me having these miracles, until he heard me talking to Dr. Gurgler on the phone and some of the other doctors and hearing all these miraculous results. Finally, he said, I think I'm going to try that. And my husband, I'm sure, had Lyme disease too. He was diagnosed with lupus. And to make a long story short, but he had a stroke, a blood clot in his leg, and had neuropathy since 2007 in his foot. He had to wear a brace. He couldn't walk normal. He couldn't jog. He couldn't ride a bike. And on day 4 of taking this, I got a phone call from him. And sorry, I get a little emotional because it's just, I hear these stories and it's so life-changing for them. But he started to get feeling back in his foot.
Wow.
About 3 weeks later, he sent me a video one of his coworkers took of him jogging down the stairs. This is giving people so much of their freedom back. Is it the be-all, end-all, do-all? We don't know. We want more tests. And we're finding out that we're not going to give up on the people that are taking a little longer. But some people want quick fixes, don't they, Art? They want to just get on something and take the pill, take the symptoms away and be done with it. And the reality is some of them are having to stay on it a little longer. One of our partners who tested negative, actually his fingers are starting to straighten out because the arthritis inflammation is easing up, and his hands are starting to go straight. In time, he's continued to use it. Now, do we want these people to be on this serum the rest of the supplement the rest of their lives? No. We want them to get to a state where they're get their immune system back online, get healthy enough they start eating a healthier lifestyle, decreasing stress, getting more rest, and we hope they get off it. We are not in this to build some brand and become billionaires. We're in it to help the people that are suffering. And the doctors know that. We know that. They know that we are very sincere. We've donated a lot of product for case studies to be done and for people that couldn't afford it. And our goal when we get into volume is, and actually someday get profitable, is to create sliding fee scales and get this out there so it's affordable and accessible to everyone.
Yeah, great. So,
but right now, my God, $150 retail, $160 that creates the incredible relief of symptoms. I mean, a typical bottle is 48 servings, which if you're standard, you're taking it for 48 days. A 16-ounce bottle, $275 discounted. So compared to some of the other protocols that are $350 a month, upwards towards $650, and inpatient programs that are $40,000 and $50,000, I'm hearing.
Yeah.
It's at a price point that we believe is very affordable. We've done everything we can to make it affordable.
Absolutely. So, Dr. Gurgler, a question came in from Lisa. I've had my head spinning all spring from mold. I am starting to be paranoid during the spring. I'm having more mental health issues this year. I was on LymePlexPLUS for around 3 months. My symptoms didn't go away totally, so I stopped using it. Would you say that I was not on the LymePlexPLUS product long enough? I was tested positive for Lyme's. I had bipolar 3 years ago. I'm 60 years old. That is unusual to have bipolar at 60 years. My environmental doctor stated that my mold disease went neurological. So having more symptoms in the spring, is that a sign of my progression of Lyme's?
Well, it's a very good question. And of course, she's trying to get an opinion on just on a video, which you really have to involve personal individual testing to get the answer. This is typical of Lyme patients. When you think about what can mimic Lyme disease is the Great Imitator, but there are other things that can mimic Lyme, such as chronic Epstein-Barr virus, chronic mold illness, and a lot of patients do have both of these. The only way you can decide how much is enough and how much of what to treat is to do individual energy testing, either muscle testing or aura testing, or there's a Rife machine that gives biofeedback, the Spooky 2. You really have to dedicate your situation to that. But I can say just empirically, and a general rule, if you're 60 years old and you have Lyme disease, 3 months of Lyme, did she say 3 months?
3 months.
Yeah, that's pretty short course of treatment for Lyme. I would go longer than that. Most of our patients with Lyme alone go 6 months, 5 or 6, even 8 months. And if you have another infection with this mold, it could make it a little longer even. So I would say not to give up. As long as there's been some improvement, I would continue with it. But of course, you can treat mold. There are other ways to treat mold as well, with antibiotics, with other things. So that becomes a little complicated, and you can't just look at this as simply Lyme disease. She has two factors here causing prolongation of treatment: her age and the complications of mold disease. So it is going to be a little longer than usual. Might even be a year, but usually not that long. But one of the biggest treatments of mold disease is to get out of the situation that's caused it, and that's very, very important. If she hasn't done that, the mold's just going to keep on growing in her body, whereas that's not the case with Lyme disease.
Yeah.
So she's got to make some physical changes in her environment to get away from the exposure to mold.
I know, and that's really tough in some places of the world, because it's just, you move from one moldy apartment to another. But what are some good, mold is a great topic. What are some good ways to kind of know or test or have a place tested for mold that you know of to help people so that they're not as exposed?
In terms of testing, there are two types of tests. There's a urine toxin test, which is very expensive. One lab does this, Great Plains Laboratory. It runs usually about $800. Another much simpler test, it's not quite as accurate, is a blood antibody test that tests for about 8 different strains that a lab called Genova does in North Carolina, and some other medical labs do it as well. That could be a start. But
What about
diagnosing mold?
What about testing like a home for mold?
Well, that's very easy, but it's expensive also.
Oh, okay.
There are companies that do. You can find them online. They need samples. They come in and take samples. It's very, very important to do that if you have chronic mold illness. You want to make sure it's suppressed and remediated in your home so you don't get continued exposure and continued illness from it.
Right.
You can't really get over mold illness if you continue to expose to it. It's like getting a tick bite every week with Lyme disease. Even the best of treatment isn't going to suppress it enough. So you have to get out of the environment that produced it to begin with.
Got it.
That's a very easy thing to do. There are many good companies that do this. It's not cheap, but many times it's very important to do so you know where it's coming from.
Right.
You can change it.
So, Dr. Gurgler, tell us about your practice. Tell us how to get a hold of you if someone wants to get a hold of you. I know you're doing virtual sessions now. Tell us about you and your practice and how to get a hold of you.
Well, right now, the clinic that I work on is shut down, but each individual practitioner can choose to see patients the way they want. Most of us are not. We've stopped for a few weeks, but the easiest way to get a hold of me is to contact me by phone, which is 781-752-6378, or I have an email address, agurtlermd@yahoo.com. These are the both ways that patients can get in touch with me, and we can make arrangements to do telephone consults or Zoom consults, whichever seems to be the best. But of course, it's always best to see somebody in person, especially with Lyme disease, because some of the testing cannot be done on the phone or on digital methods.
Right.
Which is so important to do.
Great. And I know that when you see Dr. Gurgler, he can also help you get LymePlexPLUS. If you're just interested in getting LymePlexPLUS, you can go to my website, NicoleWhiteWellness.com, and click on where it says LymePlexPLUS. And for March, what I'm offering is free shipping. And if you have a quantity you want to order, you can contact me. If you're in the U.S., 505-204-1437. Great. Dr. Gurgler, was there anything, I so appreciate your time. We're going at about an hour and a half. Was there anything else that you feel is really important for us to know right now, about Lyme disease, about what's going on, about LymePlexPLUS?
Well, just one last statement that because of the coronavirus, it's overshadowing every other medical problem. But when the coronavirus disappears, we're still going to be left with Lyme disease, which has been around since the late 70s. And everybody with Lyme disease should know that the more you get political, associate with Lyme support groups and get them political, put pressure on your elected officials to get recognition nationally and understanding of this, and eventually suppression with a vaccine, the better off the whole country and the whole world will be. To relegate this like a disease of yesteryear, like smallpox and polio, you have to get political with this because this is under-recognized, undertreated, and it's vastly spread across the world and the country. It's a real epidemiologic problem.
So you believe that if this got political and that if there was a vaccination made, that this could be preventable?
Could very well be that way, yes. Yes. And it
safe
needs
vaccination. Sorry, I had to interject.
What's
They
that?
did try a vaccination some years back and it failed miserably. So it needs to get serious attention from the research field, and not just the pharmaceutical industry trying to make a buck and get something out there quick.
Right.
There's been a lot of evidence, and there's lawsuits popping up that the last time they tried that, just putting one out there when they weren't ready for it yet, actually these people ended up getting Lyme disease and other problems. So advocating for the, yeah, there are lawsuits tied into that. I can't make any statement of such, but there are accusations in the court of law and an awful lot of research with that. So Dr. Gurgler's right. We need to put more money and time and attention to this horrific disease. And more people have it than you can ever imagine. There's people walking around with Lyme disease that have no clue. Yeah. And I was in Las Vegas, Nevada. I was in California. I've been all over this country. And it is not just in the red states. It's spreading across this country. And we need to take it serious because like Dr. Gurgler said, the coronavirus is going to come and go. But Lyme disease has been here for what? What was it, 1975, Dr. Gurgler, when they first... Yeah, and we need to continue to pressure the Lyme groups are doing this. The Lyme Warriors, the Lyme Foundations, are putting more pressure and attention on advocacy to get more money put into this. There were far more people infected with Lyme disease at this point than even HIV. And it's a much slower, more painful death. I get very sad when I see young people's obituaries floating down my timeline on Facebook because of Lyme disease. You know, something's got to be done with this, and it's going to take all of us to bring attention. So I want to thank Dr. Gurgler from the bottom of my heart for being so brave and so dedicated for the last 10 years. To become a Lyme literate doctor, not to just buy into the conventional medicine approach, to be open-minded and wise enough to understand that there are many breakthroughs that are considered all natural. It doesn't mean they're snake oil, or it doesn't mean that they're not effective. It means more people need to take a look at them, and more research needs to be done. We have been begging. We've been working very hard to get more people to more organizations to look at running clinical trials with this natural supplement. This medical breakthrough really is what it is. And no one would know about it if it wasn't for Dr. Arthur Gurgler. So thank you. Thank you so very much for hearing us. And the hundreds and hundreds of people already, even though we weren't really advertising it last year because we wanted to see the different methodology, the different protocols. We wanted to make sure that we could give it out to the world in the best form possible with enough history for Lyme disease possible. And we're ready now. We've got enough data and we've got enough of experience and enough word of mouth going on and enough doctors testing it. And obviously they figure out it works for autoimmune disorder. Our focus is going to stay on Lyme disease. We're very committed to it.
Mm-hmm. Wow.
So thank you so very much.
Thank you both so much for taking the time. Dr. Gurgler, was there any last thing you wanted to add?
No, I think we pretty much covered everything.
We did.
I want to thank you for having the gumption and the sincerity to present this to your clients and to everybody else and recognize the importance of this whole issue.
Absolutely. Absolutely. It's
Thank you, Nicole. Thank you for helping us to draw attention to this.
Absolutely. Absolutely. Well, we're going to close the webinar now. Thank you to everyone who's joined us. And if you have any questions, you have Dr. Gurgler's information, you have mine. I can be in touch with both of them if there's more questions that you guys have that you want answered. I could potentially bug either one of them to send me an email, perhaps. So
of course.
Thank you everyone for showing up tonight, and may you be well, may you be safe, may you be happy. Thank you everyone.
Namaste. Thank you.